Let's get some analysis now on our top story. The South African Medical Association has called on government to enforce stricter lockdown measures, saying that some members of the public are not adhering to COVID-19 health protocols. South Africa is operating under lockdown level 2 amid the third wave of the coronavirus in parts of the country. The health department has recorded more than 5,000 new daily cases for a third consecutive day. Now let's discuss this further. We're joined on the line by South African Medical Association's Chairperson, Dr. Angelique Coetzee. Dr. Coetzee, thank you so much for your time this afternoon. Now, before we get to the numbers, I can't proceed without asking you this question. Just as the South African Medical Association, what is your reaction to some of the allegations that have been leveled against Health Minister Dr. Coetzee as far as it relates to the Digital Vibes company? Now, what's your take, firstly, on just the impact that this will have on South Africa's efforts, to curb the pandemic that we are currently dealing with?
Good afternoon, and thank you for asking our advice. Regarding the problems that the Minister of Health is finding himself in, I think what we need to do is we need to let the process go its way, but also the correct thing would be to stand aside for now for the Minister until it's been resolved. I think that would give more honesty to this whole process, and from our side, we just wish this process being or this investigation's been fulfilled, and so that we can carry on with the pandemic and everything that is happening in the pandemic. We don't need this to sidetrack us as well.
All right. Now, looking at the numbers, Dr. Coetzee, the health department has recorded more than 5,000 new daily cases for a third consecutive day. You are saying that government should impose stricter measures to South Africans. We are in level 2 lockdown. What are some of those measures that you are suggesting?
Look, we said that it's a step in the right direction, and we are speaking totally from a medical point of view. And for us, we need to protect the people out there, and we need to protect their health care, especially our hospitals, which will not be able, again, to handle a huge influx of patients with severe COVID at one time. And that is always the problem. If everyone gets sick once a day, or one per day, it's fine. But if you get 10 patients per day coming into a facility, it puts a strain on the facility. So if we look again at how the disease is spreading, this virus needs a warm body. And for that to happen, a person doesn't wear his mask, there's no social distancing, they sit close together, and there's no ventilation, and air cons is on. And that is the recipe for a disaster, especially this winter. It's cold out there. So we are seeing cold and flu. It's difficult to distinguish between a normal cold and flu and a mild COVID-19. So if we miss it, it means you go on and you spread the disease in your working place, especially, again, if you go and have a drink after work, sitting in a taxi, going to a funeral, because only in your mind you only have a bit of a cold and flu. And it's really, our problem is people doesn't adhere to the regulations and non-pharmaceutical measurements that we have put in place. To use the Afrikaans word, people are hurtful to do the right thing, but it's going to cost us dearly, and that's why we ask just to be stricter over weekends with the curfew. Let's look at the taxis. Let's look at indoor house gatherings and funerals and after funerals and parties. It's a huge problem.
Dr. Coetzee, I'm not going to repeat that Afrikaans word that you've just mentioned, but it is possible, though, that COVID-19 fatigue is a real concern for many South Africans. So, and I think largely also it has to do with just the process of the vaccination and how this country is handling that. Perhaps bring us up to speed in terms of what is happening on the vaccination front. I mean, are we making any headway? We know that, there's still, the jury's still out in the Johnson & Johnson vaccine. We know that 60-year-olds and above are now being vaccinated. What is the latest there? Are we anywhere close to reaching that herd immunity that the department keeps speaking about?
We're not near. And the problem, one of the problems that we are facing currently is that only 24% of all the vaccines is going to the private sector. It means 24% of vaccines is being allocated to people with medical schemes. So that's why it is difficult for these people to get all these messages and to say, when am I going to get vaccinated? There's only that amount of vaccines available in the private sector. The rest go to the public sector. There's poor communications from the sites to open up their slots so that people can get a slot for tomorrow or the day after. Part of this is not only National Department of Health, but it's also lying with the sites themselves. We have the problem. We have asked the big pharmacies like Dischem to please take 15% of your vaccines and vaccinate, give that to the healthcare workers, or allow slots for healthcare workers. They're refusing to do that. So going forward, we are, especially now, in the midst of the winter, we are really going to see these numbers moving upwards very, very nicely. And if I say nicely, I'm actually mean it's going to be, it's not nice. It's actually something to cry about what we are going to see within the next 2 weeks, especially with this weather.
Now, before I move on to my next question, I'd like to stay on this vaccination point. There is some confusion out there in terms of the period between your first dose of the vaccination and your second dose. Can you perhaps maybe clarify to our viewers what the actual process is? Some people have been vaccinated, have to come back after a month, while some say that it is 3 months.
Okay, thank you for that one. That's a very important question. No one will go back after 21 days. Even if they had received their WhatsApp, they will not be vaccinated. The reason why we have extended the period from 21 to 42 days is because we're trying to, with the limited vaccines that we currently have, we are trying to vaccinate as much people as possible and then extending the second dose to 42 days. With the hope that when the 42 days start, it will be close to July when a lot of vaccines is going to come in. So we're trying to vaccinate as much as possible, but it is safe to wait 42 days for the second jab.
All right, another confusion, not really a confusion, but just some clarity needed on the third wave. We know that, for instance, we're seeing high numbers in Gauteng, and we also saw those numbers rise up in the Northern Cape, which was not previously seen before. Talk to us about where the country's at the moment. Are we on the third wave currently, or are we still seeing some pockets of provinces being there already and starting to come out of it?
So from SAMA's side, we are saying unofficially we are in the third wave. Officially, we are nearly there. They're waiting for 6,000 per day, and then they will declare that it's officially we are in the third wave. We're not going to get out of it now. We are in the beginning of the third wave, and it's still going to be with us. I think the projections is that we will reach the top of the third wave sometime next month in July. So for now, we are moving in. We're not moving out of any wave. We are going into it. And that's why, again, the restrictions regarding, people coming together, it is so important. Actually, to tell you the truth, if people did listen and didn't go to the parties, didn't do 40 days, the school children, didn't just listen to what we have said. It would not have been necessary to go up, to increase the curfews at night. Nothing of this would have been necessary if each and everyone just did or play their part that we keep on asking them.
But having taken everything that you have just said in this interview, how far are you engaging with authorities that could actually make these measures that you are suggesting even tighter? Because, I mean, if you have to look at some of the constraints that we are facing in the country at the moment, and taking into consideration that many of our grade R's and 7 learners will be going back to school in a couple of weeks' time, it will probably accelerate those numbers too, don't you think? So how far are authorities actually taking this seriously?
Well, there's so many crises going on in the healthcare. I'm now talking in National Department of Health with this, this investigation. It's the investigation in the affairs of the minister. It is the investigations in the corruption center. It is the investigations, there's not enough water, there's not enough electricity. If you look at the healthcare sector currently, it's a very sad picture. So so on top of it, we have the winter, we have the cold weather, we have children going back to school. I'm not even sure whether there's water at all of these schools. So we really are moving nicely, as I have mentioned before, very nicely into the eye of a storm.
Dr. Coetzee, final question from me, and perhaps putting you in a very difficult position. We've seen the situation in the country last year when the numbers were soaring. We saw what it did to the livelihoods of South Africans. Are we ready for a third wave in 2021?
A very difficult question. I think we are very slow learners. I don't think we learn fast enough from our mistakes. I haven't seen employment of nurses, doctors, to help in especially the public sector. I haven't seen that. And the opposite, because there's still restrictions on appointments of new personnel. You have seen again the water crisis in Gauteng. We don't learn. We're very slow learners. I'm sorry to say that.
Dr. Coetzee, thank you so much for your time this afternoon. Always a pleasure speaking to you. That was South Africa's Medical Association's chairperson, Dr. Angelique Coetzee, painting a very bleak picture there as we move to the third wave of COVID-19. So from her, I think we all need to do our part and take care.